doctors. I've been suffering from hemorrhoids for 20 years. And when they flare up, the pain is so bad that I can't sit down. When I go to the bathroom, the hemorrhoids are always bleeding. I'm afraid to get the hemorrhoids removed because I think they might cause anal skin tags. Doctors, I really need to know what is worse, hemorrhoids or anal skin tags.
Oh my God.
I mean, what are they talking about?
Does
people have these things?
I mean, I hear this a lot from my patients, obviously, as a gynecologist, but does every single one of your patients come in and start their statement with, "This is so embarrassing"?
Yes. Everyone. And I'm shocked they even make it in my office.
Would.
Like, that's why I'm like flattered that they get in.
The first thing I said was, "It hurts!"
Yeah. I have a little anal pillow there, the prop anus thing.
It's almost remarkable to me that we don't deal with that things go so well down there on a. Is that an anus?
It is.
It's an anal pillow.
It's an anal pillow. It's. I don't know why. Yes. Yes. I carry this with me. So I don't know why they used the flour for the anus, but they did. But I mean, as far as it goes, I mean, this is the anal, the outside anal skin, right at the edge. This is where the hole would be, where stool comes out, and this is basically the buttock. And on the outside, I mean, hemorrhoids themselves. We'll talk about that. It's TMI Tuesday, so I'll let everybody know I have hemorrhoids. Okay, and I'll let you know everybody has hemorrhoids. We're born with them. It's part of our anatomy.
For sharing.
Yes. Yes. They're veins. They're venous cushions. They're inside and outside. And the inside hemorrhoids are painless. So when you go to the bathroom and you see blood dripping in the bowl and we think that we have cancer and things are really bad, it's a hemorrhoid that broke. It has no nerve ending, so you don't feel it, and you see blood on the paper. The external hemorrhoids live right around the skin. I mean, actually, if you get a close of my hand, I mean, this is the external anus, and here's where the skin is. When an external hemorrhoid ruptures, the blood leaks out under the thick skin, it gets trapped, and it forms a clot or this knot, and then you get the swelling. Like if you smack your thumb, it just swells, and it hurts so bad.
Yeah, that gets your attention.
That gets your attention.
What causes the itching? You know, a lot of patients complain about itching.
Usually the internal hemorrhoids, they go in and out, or they secrete mucus, and if we don't eat enough fiber, you'll hear me say this over and over, fiber and water. If the stools are sticky, we're wiping a lot, that stool stays on the anus, and it coats the skin and causes itching.
That's probably, too, just because there's so many nerve endings. It's a very sensitive area that you're sensitive.
So you get that hemorrhoid.
Itch.
It swells, and then the skin stretches. The hemorrhoid takes the thrombosis takes 4 to 5 weeks to go away. The pain starts right off, weeks. The pain and the pain, just down a second.
Unless
the pain
you
and the
remove
thrombosis are here, but in 5 days the pain goes down, but the hemorrhoid itself stays up for about 5 weeks, and then it finally goes away.
I always thought it was a week.
Usually about 4 to 5 weeks. It can be a week. I've seen
some. It can last long. It can last longer. I speak from personal experience on that one.
Don't you want to remove those thrombos?
You know, 98% of the time I do not. I've talked patients out of me removing their hemorrhoids and getting rid of them because it'll go away on its own. And if you can just get through that time, if they're miserable, then I'll do it.
So are there things that people can do to try to figure out, is this an internal, external hemorrhoid? Is it a skin tag? Is it something known as an anal fissure?
Correct. That is the key. I mean, tags that come from hemorrhoids, stretched skin. The biggest problem I have, the most misdiagnosed condition in the human body is an anal fissure. So a lump on your rump that bleeds and hurts, everyone thinks is a hemorrhoid. But if it hurts when you go to the bathroom, a sharp pain like you're passing a shard of glass or a razor blade, that's a tear of the skin. That skin is trying to heal, and it keeps ripping, and it keeps ripping, like a split lip.
And you have a demo that you can show us how you remove.
Correct. So this is the tag. This would be outside the anus, and this tear actually is coming inside about maybe a half an inch. And this tear hurts. So if you're pushing on this tag, it's really the fissure that's causing the pain, and there's so much innervation down there that you can't tell the difference. So basically, once I inject it, I would just come in and cut on both sides, cause a fissure. And now there's a lot of swelling and there's a lot of skin on the outside. What's going to happen is that's going to contract down, and obviously they'll get to the base. So the other problem I tell people is I'll remove your tag, and what are you going to get? Swelling from surgery. You may get another small tag. So it's not perfect. You'll never have the anus you had when you were 6 months old.
But there are things we can do to reduce our risk of straining. You've talked about constipation. Childbirth, which
you can't avoid it. Almost 50% of women when they're pregnant, right? We see it all the time, get awful hemorrhoids, again, because of that change in that blood flow in the pelvis. I remember after I had my first child, I pushed for 2.5 hours, and right as he was coming out, my obstetrician said, "Ooh, you're going to have some wicked hemorrhoids.
Well, that's
and I thought,
thanks.
what about what you don't want to hear in the delivery room?
Oh my goodness.
Yeah, exactly. So it's really a almost universal issue affecting so many women.
And a lot of patients come in and they have a skin tag and they think it might be a genital wart. And I always tell patients, I'm like, if you look at it, there's a big difference between a genital wart and a skin tag. Skin tag just is a lump of skin, whereas a genital wart looks like clusters of cauliflower.
Yeah.